Next week, the head of the CDC will travel to the heart of the Ebola outbreak in West Africa to see for himself how it's being handled. But as Debora Patta reports, the fight there is growing from a health matter into a criminal matter.
The World Health Organization has admitted it has no idea when this Ebola outbreak will end. The disease continues to spread at an aggressive rate in West Africa, having claimed over 1,400 lives and infected over 2,600 people. But these numbers could be a lot higher, as many families are hiding relatives infected with Ebola because they don't want to be placed in isolation wards. Sierra Leone has now made it a crime to hide Ebola patients, punishable by a 2-year jail term. Doctors Without Borders coordinator Henry Gray says they are building a bigger treatment center in Liberia's capital, Monrovia, to deal with the relentless demand for medical assistance.
We are expanding our site at the moment. Within the next 10 days, we hope to have a site that can welcome up to 400 patients.
Professor Shabri Ahmadi heads up the Institute for Communicable Diseases in South Africa.
We're talking of places where, to a large extent, healthcare doesn't exist to any meaningful level.
As the crisis deepens, countries battling Ebola are becoming increasingly isolated from the rest of the world. Ivory Coast, Senegal, Cameroon and Chad have all closed their borders to affected countries, while central hubs like Kenya and South Africa are preventing non-citizens from West Africa, including healthcare workers, from entering their countries.
When the 2 American health workers walked out of their Atlanta hospital Ebola-free, it should have sent a message of hope to the hundreds of West Africans battling the deadly virus. Instead, all it's done is highlight the massive gap in quality healthcare between developed and developing nations. Debora Patta, CBS News, Johannesburg, South Africa.